Experts speak on adolescent drug abuse and where it begins. A presentation by experts. Laurie J. Head, November 17th, 2014, Psychology 496. Where does adolescent drug abuse begin? How and where are they exposed to illegal drugs? The answer to these questions can provide help to children who are using drugs to stop and to prevent children from starting to use drugs. Studies have shown that children who are exposed to illegal drugs by a family member, often parents, are more likely to do drugs as an adolescent and into adulthood. Parents who currently use drugs are more likely, sometimes up to 3 times more likely, to have children who also use drugs. Most adolescents begin use of drugs from age 12 to 18. The 2010 National Survey on Drug Use and Health revealed that 7.4% of youth this age had used marijuana, and 58.5% of the 2.4 million recent marijuana initiates had not yet reached their 18th birthday. Meet the experts, Dr. Howard A. Little and Dr. Stanton Peel. Dr. Little is one of the leading giants in the field of family therapy and adolescent drug research and treatment. Joining the Miller School in 1998, Little brought with him the P50 Center Grant, the first such NIH grant that enabled him to develop a treatment center based on research. The center was the first clinical research center focusing on adolescent drug abuse treatment to be funded by the NIH's National Institute on Drug Abuse. Dr. Little has given several lectures on adolescent and family drug abuse titled Evidence-Based Practices for Treatment Substance Abuse in Youth and Psychotherapy Revealed, a glimpse of eminent psychotherapists at work. Within each of these lectures, his videos of his work are shown. As children are exposed to alcohol, drug use, and culture, either in the home or in the immediate neighborhood, children maltreatment rates increase and exposure becomes predictive of future adolescent substance abuse. Dr. Stanton Peel has been a pioneer in applying addiction beyond the area of drug and alcohol, social environment causes of addiction, harm reduction, and self-cure of addiction. He has pioneered, among other things, the idea that addiction occurs with a range of experiences, recognition of natural recovery from addiction, and the harm of reduction approach to addiction. Dr. Peel's expert advice on addiction and where it begins is vital to understanding, treating, and conquering drug addiction within families. For parents who currently use marijuana, preventative communications should stress the fact that their actions may influence their children's expectations, attitudes, and ultimately initiation of marijuana use. Compare and contrast. Dr. Little is for family treatment for addiction, evidence-based practice for treatment, and provides training for other medical professionals. Dr. Peel, addiction occurs within a range of experiences, practice-based evidence for treatment, and provides training for other medical professionals. Where they agree is that exposure of a child by a parent to drugs will more than likely result in the future use of drugs by that child. In conclusion, exposure of illegal drugs to adolescents by parents or family members is a serious topic. In order to cure addiction, we must first understand where it begins and how to prevent it from reaching our children.